My name is Jeff Caruth. I'm a cosmetic surgeon in Plano, Texas. We mainly concentrate on minimally invasive procedures involving typically newer technology for cosmetic purposes. Most of our procedures are done under local anesthesia in the office, either in a procedure room or an exam room type situation. AccuTIte is really very effective. It's a very powerful tool, and it can be very effective at tightening these areas that are related generally to aging or possibly other situations, but it's very close to a surgical result without having surgery and the recovery involved with those types of procedures. So I think even though it's minimally invasive, it's a very effective tool that can approach the results of a surgical technique. I think the perfect patient for the AccuTIte procedure is anybody that comes in your office that wants just a little bit of tightening along the jowl or the submentum or maybe the nasolabial folds or under the eyes or above the eye, and really doesn't want to undergo an invasive procedure like a neck lift or some other type of procedure that may involve injecting something into the fat to melt the fat. So I think it's a procedure that fills a gap for those patients that don't really want to have a surgical procedure. It's a minor, minimally invasive procedure that can be done in the office under local anesthesia. It takes 30, 45 minutes and the patient can be out and back to normal activity in a day or two. As far as AccuTIte affecting the revenue, it's very positive, because if somebody's coming in to do a procedure like skin resurfacing or fillers or anything like that, even Botox, it's very easy to talk to them about this very small, precise instrument that can be used to tighten the folds or the submentum or the jowl or small areas of the body like the axilla or maybe even the knee. And it's very easy to basically upsell them on some other very minor procedure that is very effective. And so I think it's a very important and effective way to improve or increase your revenue on patients that are really just wanting very minimal types of procedures. So typically we see patients that have multiple concerns, maybe their skin tone or texture, skin laxity, acne scarring, wrinkles, multiple issues. So we usually combine the AccuTIte with other technologies like Morpheus 8 or Forma or Lumecca or other things, because we're addressing different issues. So ideally you want to combine these technologies to get the best results for patients, which are all very effective, but maybe for a little different purpose. But it's very easy to combine those procedures together to get the best results. I think that the newer technology like InMode provides, people are looking for the newest and the best technologies. And as time goes along, there's always going to be something new, but these procedures are very effective, and patients typically will go and tell their friends, I had this procedure, I had my neck done, I had my arms done or whatever, and generally they're very happy and very satisfied. So they go tell their friends, and then their friends come in and say, well, I want what my friend had because she looks great. And so I see that all the time, and patients refer other patients, which is great for your practice, obviously, because it's very expensive to advertise to patients. But if you have the latest and greatest technology and you are getting excellent results and the patients are happy, they're going to tell their friends or their family or whatever. So we have a lot of people that refer us patients that have had these types of procedures for sure. So our patient today is 59 years old. She's in very good shape, and she basically just wants a little bit more tightening along the jawline and the neck. You can see she doesn't really have much fat. So her problem is not so much of a fat issue, she just needs some tightening. But overall she's in very good shape. She's got good skin tone. So we're going to tighten the jawline, or along the neck and submentum and along the jawline. We're also going to tighten her jowls a little bit, and maybe tighten along the marionette line here, where you would normally kind of put a filler here. We'll tighten that up a little bit with the AccuTIte. And at the end of the procedure, we're going to do Morpheus over this whole area to provide more tightening. So just marking generally, typically you want the patient kind of setting up in some relaxed position. Bend your head down a little bit. So you can see when she bends her neck down a little bit, she's got a little bit of loose skin here. So not really so much fat, just a little bit of loose skin. So relax your hair. But in general, what you want to mark first, I usually just mark the jawline first. And so I just kind of, you can make dots or a line or whatever you want, but just kind of mark right along the mandible. And just to identify that, because once you put the tumescent anesthesia in there, it's a little bit more distorted and it's a little bit harder to see exactly where the jawline is. So theoretically, we're going to stay here below the jawline, then we'll go up above the jawline. But so here's the jawline, and I'm going to mark down along the muscle, the sternocleidomastoid. So I'm going to mark down along that, and we're going to come across here. And we're just going to come up on the other side to kind of make a nice area to treat this and tighten all this up. I usually make a center line too when I make chin up just a bit. So here's the submental crease right here, so we'll make a line there. And then usually I make a center line, which is here. So that's the center. And then you can see she's got just a little bit of platysmal banding here, which is the edge of the muscle, but it's not bad. So I think overall she's a really good candidate for tightening. And then we're going to tighten up the jowls next, but usually I'll treat this side and then I'll treat this side separately. And then once I'm done with that, then we'll go up and treat the lower face or the jowl area. So typically when you're treating the lower face of the jowl, what I do is I take a marker and I just mark right along the marionette line. Okay, so this is the marionette line here. So we'll mark along there. So basically the issues that you want to avoid is the marginal mandibular nerve, which tends to basically come out here and goes under the parotid gland and then comes out superficial a little bit up in here. So as it goes to the depressor anguli oris, which is the muscle that pulls the edge of the mouth down. So, and generally, as long as you're superficial with the suction or the AccuTIte or FaceTite, then you really shouldn't have an issue. It's really more if you go below the platysmal muscle, which you shouldn't do. So if you stay superficial, you'll stay out of trouble. So typically, the marginal mandibular nerve, I'm going to go ahead and mark this just right here. So we'll mark that, and we'll mark this. So the marginal mandibular nerve, you want to typically avoid kind of this area right here. So this is where it's fairly superficial right in here. So generally what I'll do is I'll make another little incision just a little bit lateral to that, maybe about right there, to treat the jowl area. The same thing on this side. Here's the marionette line, comes down here, marginal mandibular nerve is superficial about right here. And so I'll make another little incision just a little bit lateral to that. I'll make a little incision here to treat the jowl area on this side. And then to treat the lateral neck, I usually make a pre-auricular incision or infra-auricular. You can kind of do what you want, but typically somewhere about there, just below the ear, or you can kind of go behind the ear a little bit more if you want. You don't want to go too far behind the ear because then you don't have a good access point to treat the neck. So when I mark the jowl, typically the jowl is this little area right here. So what I do, you can kind of see, turn this way a little bit, good. So you can see the jowl is kind of right in here, underneath the mandible, and then right above the mandible. So this is kind of the area that we want to tighten up, this little jowly area right here, okay? All right, I'll turn this way a little bit. So we're going to do the same thing over here. We're going to go right along here, underneath the mandible, and kind of come up and try and treat this little area here. So again, this little jowly area right here. So we want to define that and tighten that as much as possible. We'll use this little incision just lateral here to the marginal mandibular nerve where it's pretty superficial. So we'll use this little incision here, and we'll treat above and below the jawline. Not the jawline, but above and below. Okay, so I'm just going to mark that a little bit more obvious there. So we'll do FaceTite from the jawline down, and we'll use AccuTIte on the jowls. Then we'll go back over the whole area that we've treated with Morpheus at the end. We're going to prep her with a little bit of betadine, and then we're going to start the tumescent anesthesia part, which is putting the numbing solution in. and then we'll start the procedure. Typically, this is using a tumescent anesthesia or local anesthesia, similar to what you would use with liposuction. And so tumescent anesthesia is basically just saline with lidocaine and epinephrine. Typically we're using a solution of saline, and I'll mix a 500 cc bag because we don't need 500 cc's for the neck. We'll probably use 150 cc's or so. Some people use a little bit more, some people use a little less, but in general we're going to put 500 milligrams of lidocaine in a 500 cc bag. So 1 milligram per cc.
So we basically infiltrated the whole neck here below the jawline, and eventually we're going to have to come up here and infiltrate a little bit up here as well. We'll go ahead and treat this area with FaceTite. FaceTite is composed of this little probe that's 10 centimeters long and about 1.3 millimeters in diameter, and then you've got this little superficial part of the device that's going to just glide over the skin, kind of like an iron. And so we're going to insert this little probe under the skin, and it's going to emit radio frequency energy or heat to help not only melt fat, but tighten the tissue, stimulate collagen, tighten the fibroceptal network, which is a network of fibers underneath the skin. And then as the energy is transferred from the tip to here, then it will also heat the skin. And this will heat the skin up to around 38 to 42 degrees, depending on what you set it at. And we know that once you reach those temperatures, you're going to stimulate collagen. So we're not only going to get tightening of the tissue from below, but we're going to stimulate collagen and tightening of the skin from above. Okay. So now we're going to set the temperatures that we want. So we're going to set the external cutoff temperature, which is monitoring the temperature of the skin. And so typically that's going to be between 38 and 42. If you're just beginning and you're not quite sure, then go more towards 38 to be safer as you get more used to the machine and the way it reacts. Then you may go up to 39, 40, 42. I typically set it about 40, so we'll set it at 40. Also depends on the patient's skin. If the patient has good skin, thick skin, then you'd probably go up a little higher. If the patient has really thin skin, then you may want to stay down around 38 just because there's much more risk of burning somebody with thinner skin than thicker skin. And so the internal cutoff is the temperature is going to cut off for the internal part. I usually set that on 60. You can go up to 70, but I don't really recommend 70 for the neck. I'd probably stay around 60. If somebody has, again, thicker skin, more fat, I might go up to 65 or so. But typically 60 and 38 to 40 is a good starting point. This treatment time, you turn this up all the way to 2 minutes or 120 seconds. So we'll put a little gel in there, aquasonic gel. And so really what I'm kind of concentrating on now is just the submental area and the midline neck. And so we'll insert that, you're fine. And so again, extend the neck as much as you can. So we're going to insert this. Okay. And then first I'll insert it, and then I'll only use energy on the way when I'm withdrawing it. So you'll hear it. So when it triple beeps like that, that means it's reached the temperature, and it takes a little while to get used to, but that's the deep. The skin's going to take longer to heat up. So I'll move it fairly slow to heat the tissue up. If you move it too fast, then you're not going to heat the tissue. More of the energy is going to go towards the skin. So basically I'm just kind of making a passage here of the fairly superficial, but she doesn't have a lot of fat, so there's really not a lot of deep tissue, but we're going kind of like a spokes of a wagon wheel or something, and I'm just going a little bit lateral each time, and I'm retracting it. And I know I can hear a popping noise. That means the fat's coagulating or the tissue's coagulating. I like to hear that sound because I know I'm reaching adequate temperature. So as I withdraw this, I'm heating the tissue. If you're moving too slow, then it'll just keep beeping, and then you won't be delivering energy. When it's triple beeping, then that means it's not delivering energy. Okay, so I'm still just kind of tightening this area up here. I kind of made one pass there. So my skin temperature is up to about 33. And I want to get it a little bit hotter there, so just a bit, good. So I'm going to go back to the midline, and I'm going to go across again. Now, on the neck, you can deliver energy while you're going in and out, but I think it's safer, especially starting out, just deliver energy on the way out. If somebody's got loose skin, you may need to retract the skin a little bit. In other words, if the skin's real lax, you don't want the skin moving with you, so you might put a little traction against the skin to keep it tight, and just move it slowly back towards you. You don't want to come back to the incision point all the way, because you don't want to deliver too much energy to that area and risk burning that area. So almost back to the incision point, but not quite. You don't want to tint the probe. Tinting the probe is where you have it tinted like this, or you're trying to push it up towards the skin. You don't want to tint it, you want to just stay parallel to the skin and try and deliver the energy. So far, our skin temperature is about 34 degrees, and we've delivered about 1 kilojoule of energy. So I'm still just going along here until I reach my end point, which is basically heating the deep tissue to about 60 degrees and the skin temperature to about 40. So again, I'm just kind of going back and forth over the same area. Good. So I'm just directing the probe where I want it to go, and then just pinching the tissue in between the two probes. So we're getting there. Got a little bit more to go. Good. And again, if you hear the little popping sound, that's normal. It's just the tissue and fat coagulating. That's fine. You want to hear that. So you can see we're getting closer because you're getting more, starting to hear the triple beat more. Like right there. So I'll go just in the midline here just a little bit more. Sorry. You okay? So we've pretty much heated the tissue to 60 degrees. So now I'm just trying to get the skin up to about 40. Sorry. So when you hear the double beep, that means that the external temperature is within about 2 degrees of the cutoff temperature. So ideally what I like to get to the point where I'm just kind of hearing that double beep. That way I know my skin temperature, I know my skin temperature is where I want it to be. So my skin temperature is now 40 degrees, so you can hear that double beeping. That means I'm at my set temperature essentially. The triple beep means it's cut off, it's exceeded, or not exceeded the temperature, but just cut off for safety. Good. And sometimes if I want to make sure the skin's heated up, then I'll deliver the energy going in and out. But you can hear all that triple beeping means that my skin temperature is adequate, and so I've heated the deep tissue up and I've heated the skin temperature up. So there's really not much else I can do at this point because I've reached my temperatures, and the machine's going to protect me by cutting off. Now, if you're too superficial, then you may see the skin look kind of blistery or something like that. That means, you know, there's much more risk. Hold your neck. You're much more risk of burning the skin if your cannula is too superficial. So And when you insert the cannula, insert it to where you want it to be, and then you can clamp down on the device to pinch the skin between. If you start out and you're too superficial and you can see the cannula right up against the skin, then that's not necessarily where you want to be. It's too superficial. So the energy is going to be directed right under the skin, and you're more likely to get a burn. So you want to be superficial, but not to where you're so superficial that you can see the little cannula moving. Now, somebody with a fatter neck, you know, you may want to treat at different levels, you know, deeper, middle, deeper, and then not as deep. But with somebody like her, she doesn't have a lot of fat, so there's not a lot of planes to be in. You know, you just don't want to be too superficial. So it's important to direct the cannula where you want it to go, parallel to the skin, and then heat while you're removing the cannula. As you get better, you can heat going in and out, but I think typically what happens there, especially if you're not experienced, is when you're moving in and out and delivering energy, sometimes what happens is you'll be less cautious and you'll poke the skin with the cannula. And so you'll poke the end, you'll kind of do an end hit with the cannula, and then you may get little blisters or little burns. And so I think it's important to direct it, be, you know, deliberate, and direct the cannula where you want it to go, and then deliver energy as you're coming out. Now, when you're on another area of the body, if there's more fat and stuff, it's not that big a deal. But on this area where there's not much fat, there's not a lot of space between the skin and the muscle or the fascia, and so there's not a huge amount of space there. So you want to make sure and deliberately place the cannula into the plane that you want, and then heat coming out until you get better. Okay, so we've done basically the mid portion of the neck, so now we're going to do the lateral neck, and we're going to do along the jawline here to help delineate the jawline. So again, we're going to insert our device. We've already infiltrated, so she should have good anesthesia. Again, deliberate placement of the cannula, and so my cannula is there. So remember, the marginal mandibular nerve's over here somewhere, so you don't want to go all the way up there, but just start, you know, start about here where we drew the little jolly area, and then as you insert this in heat and retract, you want to rotate this way so that the external probe is kind of hugging the jawline. Just right under the jawline, just hugging the jawline. So again, I'm going to insert it, and I'm just going right up underneath the jawline and rotating the probe to direct energy up underneath the jawline so we can get good definition of the jawline. We're at the same settings. We're still at 60. So again, we're just on the skin. We're trying to tighten the skin, so you don't want to rotate it. You want to be flat. So I'm just tightening up this lateral neck area, and I'm overlapping probably a little bit with what I did there, but there's no issue with that. Just overlapping a little bit. Okay, so I'm coming back up towards the jawline. Back up on the jaw. So I'm going to rotate now right underneath the jawline. So you can feel the jaw right there, the mandible. So I'm just rotating it and coming right underneath that. This is real important to get good definition of the jawline, rotating the device right underneath the jawline. You don't want to treat along that line, stay below it. Okay, so we're doing great. So again, we're just heating to the same endpoints. Overlap overlapping a little bit, but I'm just getting the lateral neck here. So I've heated this pretty adequately. Now again, if I want to get my skin temperature is about 37, so I haven't quite reached my goal there. So now you see if I start going a little faster and I'm delivering the energy in and out, now my skin temperature rises. So the faster you move the probe, the more the energy is going to go to the skin. But again, you got to be careful of delivering energy as you go in and out, because you're more likely to hit the skin with the probe. Now my skin temperature is appropriate there. I'm going to go up here and just do a little bit right here. That double beep means that I'm in the zone I want to be for heating the skin here. When it triple beeps, I'm pretty much done because it won't let me deliver more energy. A lot of times you don't really need to see the machine. You kind of know what it's doing just from the beeping noises. But I think at first, you know, sometimes it's helpful just to look at the machine, look at the temperatures and see. But as you get more used to the beeping and what they mean, then you really won't have to look at the machine much. So again, we're starting right on the jawline here on the side. Sorry, straight. Okay. Right underneath the jawline, rotating the device towards the jawline or underneath the jawline. Again, deliberate positioning of the probe and then energy on the way back. The AccuTIte used the same way, just a smaller probe. So I'm heating the lateral neck here. Again, making sure I know where my probe is, and then withdrawing slowly so that I get good heating of the deep tissue. So again, as you're going along, the machine's going to monitor the temperature internally and externally, and whatever, depending on what you have the machine set at. So if you're going along slowly and you hear a triple beeping like that, that just means your internal temperature has exceeded your set point. And so you want to continue to move the probe. If you just leave it in one spot, it's just going to continue to triple beep, which means it's not going to deliver energy because you've already met your set point. So again, it's not going to let you deliver too much energy, but you still need to be careful. You know, most common reason to get a burn would be just being too superficial. Otherwise, if you're in the right plane and you're not superficial, then you shouldn't have an issue with burning, because the machine is going to cut off when either the deep tissue reaches your set point or the skin reaches the set point. So if you just go slow and move slowly and deliberately, when you hear that triple beeping, that's okay. That just means that your deep tissue is heated to that set point. As you deliver more energy, neck up just a little bit, sorry. As you deliver more energy and the skin starts to heat up, then you're going to start hearing another beep, a set of 1 or 2 or 3 beeps. So right now my skin temperature is at 38, so it's going to start double beeping like that. So that means my skin temperature is within 2 degrees of my set point. So without looking at the machine, I can tell you that. As you become more comfortable with this, you'll see that basically, you know, I know I've treated the deep tissue adequately and tightened that, and now really I'm just trying to get my skin temperature up a little bit more. That double beeping, I want to hear that. Triple beeping means it's exceeded, met that temperature. So that means it's cut off. So it's really a very smart machine. as long as you have good technique, then you shouldn't have a problem. And again, I think starting out, delivering energy just on withdrawal is much safer. As you get better, then you can do it as you go in and out, deliver energy. But you have to be a little more careful about positioning of the cannula as you're moving in and out. So we're finished with this part of the neck. We're going to go up here and tighten the jowly area above and below the jawline with the AccuTIte. But again, it's important. I'm just looking at her skin. It's a little vasoconstricted. There's a little red blotchy stuff here, but that's normal. So you can have some temporary erythema, but if you see a blister, then that means there may be a very small burn there. So we're just looking at a comparison. Here's an 18 gauge needle which could be used for the AccuTIte. The AccuTIte's a little less, 0.9 millimeters. So an 18 gauge, you may even be able to use a smaller, but that's an 18 gauge needle. This is a 25 gauge cannula, like a filler cannula. And we're going to hook this up to a syringe with tumescent fluid to infiltrate the area that we're going to treat. It's just such a small area, we don't need much fluid. So if you're just doing the submenum and maybe the jowl area, I mean, you could get by with a syringe, 10, 20 cc syringe, a small cannula, some type just to infiltrate. So just showing you different options. Here's the AccuTIte, and so again, it's 6 centimeters long, and it's about 0.9 millimeters in diameter. So we're dealing with very small, instruments. But on the jowl, we're going to make a little incision site with 18 gauge, infiltrate with this filler cannula, and then treat with the AccuTIte. We're going to go back and address the jowl area above and below the mandible. So we'll do this side first, the left side. So basically we numbed this little incision earlier, so I'm going to go back and just numb it again just to make sure. But just lateral to this area where the marginal mandibular nerve may be a little superficial here. So I'm going to go just lateral that. I'm going to put a little bit more lidocaine with epinephrine there, just like that. And then I'm going to take an 18 gauge needle and I'm going to make a little incision, little opening like that, okay? So we got a little bitty opening, 18 gauge needle, big enough to get the AccuTIte in. And now I'm going to take my syringe and hook up this little cannula. It's a little filler cannula. And I'm going to put this numbing fluid in this area. So a little pinchy sweet. So this is already numb right here, the lower part, but I'm going to go right above that. Sorry. Good. So I'm going to put about 10 cc's of fluid here. This is the AccuTIte device. See, it looks very similar to the FaceTite. It's just shorter and a smaller gauge. And then this little probe here, the little superficial or external probe, very similar. You can either press with your index finger. Some people like to use their thumb. It really just depends on what's comfortable for you. So we're going to set our external cutoff temperature at 40 degrees. Our internal cutoff temperature, I'm going to set at 60 degrees. Now again, you can go down or up a little bit, but this is kind of what I use for the face. 60 degrees internal, 40 degrees external. You're going to go treat the set time back up to 120 seconds so it doesn't cut off on you. And then we're going to push standby, which says ready, and it should be ready. So we'll put a little gel there. So we're going to insert this, and then we're going to start working on this just lower. And I'm going to kind of direct it, kind of like I did with a FaceTite, direct it kind of underneath the jowl there. This heats up very quick. So right now I'm at my deep temperature is 60. My skin temperature already up to 36. So this is very fast. It's a very powerful little device. So you can hear the double beeping and triple beeping. So I'm already at 60 and 40 degrees. So it didn't take me very long. Less than a minute probably. So again, I'm just kind of going over here, make sure. Triple beeping. Okay. So you can see how easy this is to treat. Just do you okay, sweetie? Good. So it's pretty much timed me out. So it's not going to really let me deliver much more energy there. So again, my skin temperature is at 40, so it's basically just timed me out. Okay. Sorry. Okay, so, you okay?
Yep.
Okay, so now we're going to do the same thing, but up above here. So we're going to go above the jawline now, okay? So we're going to insert the little cannula, and we're just going to stay right superficial, right above the jawline. You okay?
Mm-hmm.
Okay. Again, it works very fast. So you have really good control of this device because it's very small. So the control is much more precise. Since it's not as long, you have less chance of the probe, the internal probe bending. It has a little more sturdy feel to it because it's just shorter and can't bend as much as a longer probe. We're staying right above the jawline. So we've reached our internal temperature, and the other beeping is showing that we've also reached the external temperature of 40 degrees. It didn't take very much. There's 0.3, sorry. So there's 0.3 joules there and 0.3 kilojoules there. And that's about all we need to do because basically we've met our goal temperature. So we're going to go to the other side. Again, I'm staying right below the jawline. Mm-hmm. So again, just deliberately place the probe where you want. Just deliver energy on the way out. And it heats up pretty quick. Okay, so I've reached my temperature, skin temperature. So that's another 0.3 kilojoules, so we basically used about the same. Okay, so now we're going to go above the jawline, right in here. You okay?
Mm-hmm.
Okay. Mm-hmm. So we've treated the upper lower jowl, and so I'm going to use a 16 gauge suction cannula. In this area, in this case, she didn't really have much fat, so I'm just really doing it more to kind of suction out some of this inflammatory fluid that we created by melting fat and coagulating tissue and stuff. Treated with FaceTite and AccuTIte, and now we're going to complete the procedure by using Morpheus 8, which is basically a bipolar radio frequency device that uses 24 little needles that are directed under the skin and deliver energy. So this is mainly for skin tightening. It's very effective. We're going to use this now and go over the areas that we just treated to actually accentuate the tightening even more. And so we've already set the machine. So you basically got 3 different depths of the needle. So you can set it on eyes, face, or body. On the eyes, used around the eyes or the forehead, the needles will only project about 2 millimeters. When you switch it to the face, which is basically for the rest of the face essentially, or the neck, then it's going to project about 3 millimeters. If you're on the body, like the stomach or the arms or somewhere there, the knees, wherever, then it's going to project 4 millimeters. So it's either 2 or 3 or 4 millimeters, okay? So we've got it set on the face, which is 3 millimeters, and we're going to treat the lower face and the neck with that setting. The energy, we're going to set at about 36. What I'm going to do is I'm going to go kind of right along her jawline here, and we're going to start here. So 1, 2, 3. So you see I stepped on the pedal and delivered 2 pulses, okay? So we're going to do right along the top of the jawline here. Okay, and we'll overlap about 50%. Now we're in a fixed mode, so as we deliver the energy or step on the pedal, it goes in and stays in and delivers 2 pulses, or as long as you stay on the pedal. So now I'm going to overlap 50%, we go here again, 2 pulses, overlap again 50%, 2 pulses. One more time. Okay, maybe one more time. Good, okay, good. So we treat right along that line there. So now we're going to go right along underneath the jawline. So same thing. So if you pull the skin taut, it works a lot better. Overlap about 50%. I'm doing a double pulse right along the jawline just to get better tightening. So I'm going to go one more here. One more row. Again, overlapping about 50%, making sure you're at a 90-degree angle or perpendicular to the skin. So that's it. So we treated kind of a row here and a couple rows here with double pulses. Now I'm going to do the same thing on the other side. Okay, 1, 2, 3. So the important thing is, like I said, make good contact. Don't treat where you're, off, not level. So you want to make sure you're about 90 degrees or perpendicular to the skin. One more. The benefits of Morpheus 8 are that one is delivering radio frequency or bipolar radio frequency energy, and it's delivering it through the skin into the subdermal or subcutaneous tissue. So it's helping with basically remodeling of the fat and stimulation of collagen. And so it's just another adjunct to skin tightening, which is actually very effective without, theoretically without surgery, but it can be an adjunct to surgery to help tightening too, and it's very effective. The energy can be varied. Most people tolerate the procedure very well under local anesthesia, topical local anesthesia. If you're going to treat more aggressively, probably over about 30 or so in my experience, then you're probably going to have to use some other form of local anesthetic or sedation or something like that, because once you get up to the higher energy levels, it's just going to be more uncomfortable. On this, it's perfect because we've already numbed this area, and so it doesn't really require much numbing, and it's well tolerated. You okay? Mm-hmm. Okay. So we've got a one pulse per second on the cycle mode. We're still at 36. So basically now, if I just keep my foot on there, I can move it without stepping on and off the pedal, basically. So I'm going to go to the midline and then back. So on the cycle mode, it's better for treating large areas, and you just keep your foot on the pedal, and every second in this case, it's going to deliver energy. So it's faster to do it this way, but you can't stack your pulses. You got to move. So if you want to stack your pulses like we did along the jawline, you got to put it on the fixed mode. The only thing about this is you got to make sure move it fast enough, because as long as you're standing on it, it's going to pulse again in a second. So if you're not fast enough, it may pulse before you get to the next spot. So it just kind of depends, but it is a faster way to treat an area. Now you can double pass an area. Instead of doing more pulses, you can just pass over an area again and do a double pass, and that's fine. Well, in her case, I mean, I'd probably tell her to wear the compression garment for about a day, 24 hours, and then she can take it off, and I'd tell her to wear it at night or when she gets home for about a week or 10 days, just to keep compression here.